Hello, Part 3 aspirant. With the team Decode MRCOG is here with another domain video. We have already done our two domain videos. One is patient safety and another is information gathering. What next? It's about communication. With whom? With patient and families. Although this seems to be a very simple domain to clear, but many overseas or non-UK students find it difficult to clear this domain. Is it that difficult? We do not know enough English or we do not communicate with our patient. That's the reason we are failing in this domain. No, it is not because of that. Let's see what exactly is being tested in this domain. The domain tests our ability to approach the patient and family. The role player is acting as a patient or a family member. You will be addressing either the patient or family member in this station. While conversing throughout this 10 minutes time, building a good relationship with the patient or a family member and keeping patient engaged while eliciting the history, explaining the diagnosis, investigation and treatment which are available, and assuming or taking a consent, either it can be implied or a written, and negotiation whenever it is necessary, so that we'll come to a shared decision or conclusion. These are all being tested in this domain. It is very simple. Then why one fails in this domain? What are the common pitfalls which can lead to a failure? They are very simple. Forgetting to introduce and explaining regarding your role to the candidate. Making assumption, especially about risk-taking behavior, like having multiple sexual partner, using drugs, feeling awkward or embarrassing while eliciting a difficult history about lifestyle, especially sexual history or history of smoking and alcohol. Commanding rather than negotiating. Not addressing concerns. Asking concerns will be tested in information gathering, but not addressing concerns will be communication with patient and family. So many a times the domains are interdependent or interchangeable. The two things can be tested. The one thing can be tested in two domains. In one domain it will be a highlight or a star or a bullet point, but in the other domain it will be a tick box, only a tick box. Not listening to the patient or respecting views of patient, using medical jargon or abbreviation, laughing or smiling while breaking a difficult or bad news. These are all leads to a failure. So, how to start? Is it that difficult? No, it's not. Having a confident start and starting your introduction, introducing your role, your name, and confirming patient's identity. This is a two-way process. Introducing your name, role, confirming patient's identity will also be counted as a patient safety domain. Next is breaking ice. What is ice? Ice is ideas, concerns, and expectations about the consultation. What one can do to improve the communication skill? Practicing verbal and non-verbal skill such as empathy and appropriate emotional responses whenever necessary. Acknowledging a difficult situation and offering support It can be in the form of support group or it can be in the form of counselor. Counselor will be marked as communication with colleague domain. Active listening, making and keeping a good eye contact, having an open posture and nodding whenever necessary, making encouraging sounds. This doesn't mean using okay for multiple times. You can just nod or show by your eyes that you have acknowledged the information whatever has been shared with you. Identifying the barriers of communication, especially language or disabilities. Here you can use interpreters. So asking about interpreters is also included in patient safety domain. To continue further, taking a relevant history. No need to apologize when the woman is smoking or drinking. Sensitive signposting areas, especially about sexually transmitted infections, contraceptions and terminations. Having a non-judgmental approach to patient concerns, ideas and decision. To give information in chunks and hit the pause button whenever necessary. Checking understanding at an appropriate interval. Summarizing and asking whether the patient has any questions or queries. So to excel in communication, what is needed? Encourage the patient to ask the questions, so if at all you have been sidelined or off the track, they will bring you on the track. Communication also involves eliciting history, explaining diagnosis, treatment available, along with giving a follow-up plan. Offering a patient information leaflet, which are there by NHS, and support group ideas. This will sure shot make you pass this domain, but still certain actions are needed. There are certain suggestions for developing communication skill with patient and their relatives. Practice tasks with your exam buddy to improve your non-verbal communication skill and unconscious behavior like touching, eye contact, smiling. So this will be noticed by your study buddy. Practice chunking. Practice difficult questions while maintaining a non-judgmental approach. Practice negotiation skills, especially in home birth after previous cesarean section case. Thinking about medical terminologies and replacing with non-medical language when talking to the patient. So practice is the key. Let's set go and practice it perfectly so that we will fly very high. With the support of team Decode MRCOG, let's decode the code of Part 3 MRCOG. Thank you all for watching this video.